hemiplegic or left hemiplegic, so they involve everything from top to toe. And then diplegia, paralysis of two corresponding limbs, sama ada arm sahaja ataupun leg sahaja. Okay, so paraplegia, paralysis of two lower limbs, and quadriplegia, paralysis of all four limbs. Okay, this is a term. Okay, and then ini yang penting, the spinal cord syndromes. This is called complete cord transection syndrome. Okay, everything is destroyed dekat spinal cord area tu. Okay, it's caused by fracture, dislocation of vertebral column, bullet or stab wound, and expanding tumor. Okay, so it will involve ascending lesion and descending lesion, both. Sebab dua-dua track tu berada di spinal cord. So if transection everything spinal cord, the ascending part, so loss of all sensation below the level of the lesion. Okay, this bilaterally sebab the whole cord is transected. Ingat below the lesion. If the complete cord transection at T7, so dia punya T8 and below, sensation to loss everything bilaterally. Okay, so how about the descending tract lesion? At the level of the lesion, bilateral lower motor neuron. Okay, however, below the level of lesion, upper motor neuron lesion. Okay, that is for descending part, which is motor lah. Okay, and it's bilaterally sebab the everything there, the spinal cord, everything is transected. Okay, so ada part ingat ada yang presentation dia upper motor neuron lesion, ada yang presentation lower motor neuron lesion, based on the spinal cord area, sama ada below or at the level of the transection. Usually the presentation ni akan berlaku selepas shock tu subside lah. Patient akan develop shock dulu lepas injury ni. Shock tu usually semua upper motor neuron lesion punya presentation usually during shock. Bila shock tu dah subside, barulah patient tu presenting with this one. Alright, this is all the transverse cord section. Okay, anterior cord syndrome. Okay, anterior part only. This might be due to the spinal artery blockage, so it can cause infarction. Okay, you know, the arterial supply of the spinal cord, ada yang banyak supply anterior part, ada banyak supply posterior part. Okay, ini contoh dia lah. If occlusion in the anterior spinal artery, so it will be infarction at the anterior part of the spinal cord. Okay, so after the shock subsided, these are the presentation of the patient. Okay, the ascending tract lesion involved the spinothalamic, loss of pain, temperature, light touch and pressure. Dekat posterior part tu normal. Okay, fasciculus gracilis and fasciculus cuneatus tak terlibat. Okay, so it's normal. Okay, but this one just you have to mention below the level of the lesion as well. How about the descending tract? Okay, at the level of the lesion sama, bilateral lower motor neuron lesion, and also below the level upper motor neuron lesion bilateral. Okay, semua bilateral. This one also bilateral. Okay, inilah contoh gambar. Now central cord syndrome. Okay, this is due to hyperextension macam road traffic accident. Dari drive laju, tiba stop, kena brake, accident, and the neck become hyperextension macam ni. Okay, so it can cause the crash injury. Presses anteriorly by the vertebral body. Okay, and and presses posteriorly by bulging of the ligamentum flexion. Okay, so the spinal cord ni dia akan stretch, dia akan press, sempit. So it can cause spinal cord syndrome. Okay. So what happened after the shock subsided? So these are the presentation of the patient. It can be causing both descending tract lesion to the presentation and ascending tract lesion to the presentation. Okay. So what happened on the ascending tract? Okay, apa-apa pun below. Ingat below the level of the injury. Bilateral loss of all sensation below the level of the lesion. Okay, with characteristic of the sacral sparing. Okay. Tadi kan ada yang cakap tak, kalau macam sacral sensation yang bawah, sacral, dia punya tract tu, dia punya area dekat spinal cord tu more laterally, more lateral, ke hujung, ke tepi. Okay, so kita panggil special words called sacral sparing. Okay, dia akan, maksudnya nerve yang involved this sacral S1 until S4 kan, the sensation is still intact. Bahagian batok still intact for this patient. Dia boleh rasa pain, temperature, everything. So, mungkin ada words sacral sparing for this central cord syndrome. Okay, even though it involves all loss of sensation bilaterally. Okay, then descending tract sama, at the level of the lesion, bilateral lower motor neuron lesion. Below the level of the lesion, bilateral upper motor neuron lesion with characteristic of the sacral sparing as well. Okay. Brown-Sequard syndrome, okay, separuh saja. This hemisection lesion of the spinal cord. Incomplete hemisection is common as compared to complete. Selalunya incomplete lah usually common. Okay, bullet, step bone, tumor, fracture dislocation of vertebral column. Okay, so what happened after the shock subsided? The patient will be presented with the ipsilateral loss of all sensation at the level of the lesion. Dia tak boleh cross, kan? Dia tak boleh cross. Okay, so ipsilateral loss of sensation, and below the level of lesion, ipsilateral loss of proprioception, vibration and 2-point discrimination sense, and contralateral loss of pain, temperature and tactile sensation. Okay, sebab ingat posterior white column dia cross dekat dia ipsilateral kan, posterior white column. Okay, and this pain, temperature, sensation tu dia akan cross. Sebab itulah if below level of the lesion, this sensation is lost ipsilaterally. Okay, and how about, I think is the same. Descending tract is the same at the level lower motor neuron lesion. Okay, below the level upper motor neuron lesion. Now is ipsilateral. Sebab sebelah je incomplete hemisection, so ipsilateral. Okay, so this is the level of the lesion. This is the below of the lesion. Contralaterally loss. Okay, contohnya kat sini dia punya step wound. Okay, contralateral loss of this everything, and ipsilateral loss of this sensation. Okay, and apart at the area of the lesion is hypotonic. Hypotonic means lower motor neuron. Okay. Now, syringomyelia. Okay, is developmental abnormality of the central canal formation. Embryology CNS dah ke? Belum lagi. Okay, whatever is syringomyelia, characterized and by development abnormality. Dia macam ada fusiform cavitation in the central canal. Okay, that is, and usually occurs at brainstem and cervical region. Okay, so what happened at the level of the lesion, for the ascending tract, bilateral loss of pain and temperature, shawl light distribution due to interruption of the lateral spinothalamic tract. Okay, kat bahagian atas, bahagian upper limb. Okay, and this one is normal. Okay, and descending tract lesion at the level of the lesion, bilateral lower motor neuron, and also the Onnes syndrome that present due to the obstruction of the descending autonomic fibers in reticulospinal tract. Okay, penting So the Onnes syndrome may be present in syringomyelia. So the shawl-like distribution, okay, sebab this area due to loss of pain and temperature, lateral spinothalamic tract. Okay, this is the area of the loss because it's upper part, that's why loss that area only involve the upper part of the body. Kita panggil shawl-like distribution. Okay, poliomyelitis acute, kita dah ada dekat Malaysia dah tak ada because semua ada vaksin. Acute viral infection is involved anterior, not posterior, anterior gray column. Okay, and it's involved paralysis and muscle wasting, and lower limbs are more affected. Okay, multiple sclerosis, a common disease causing inflammation and demyelination of neurons, can be due to autoimmune infection or hereditary. So ascending tract lesion, everything, and it's also descending tract also involve everything, and also plus the ataxia, involve the cerebellar tract lesion as well. Okay, these are the presentation nanti during medical posting, you know better. The presentation and the causes of the multiple sclerosis, it can be genetic as well, or hereditary. Okay, amyotrophic lateral sclerosis, involve lateral part and anterior part, or Lou Gehrig disease, chronic progressive disease of unknown etiology, and is confined to the corticospinal tract. Okay, descending tract, corticospinal tract, and motor neurons of the anterior gray horn. Okay, so this is the presentation of the amyotrophic lateral sclerosis, and what happened to him. Okay, so pernicious anemia, or the other name is subacute combined degeneration, damage to the posterior and lateral white column, okay, not gray column, as well as peripheral inflammation, it causing the megaloblastic anemia. Nanti you akan belajar hematology and immunology after this, and one of the type of anemia is the megaloblastic anemia, and one of the cause of megaloblastic anemia is pernicious anemia, because of the subacute combined degeneration which damage the posterior and lateral white column. It can cause anemia. Okay, so it causes the widespread of sensory and motor losses. Okay, dah senang tak? So apa yang I emphasize tu, kena emphasize sebenarnya. Okay, okay, ada apa-apa? Attendance please. Kalau tak ada apa-apa, okay lah, you can dismiss lah. Just ask me anytime. Okay, thank you very much.
Thank you, Dr.
I hope tak jumpa lagi next year. Okay.